The reason that we opened the center was because we have so many programs that do their own independent work that we wanted a centralized location where we could have people screened, assessed, and to refer back to the appropriate services.
The best part of the Center for Recovery Services is that anyone can call up and make an appointment, and they can receive a substance abuse evaluation within 1 week. And from there, we can decide, with their help of course, where they would best be served.
A lot of the strategies used with clients is motivational interviewing. We do a lot of CBT, so cognitive behavioral therapy, and also we're trained in EMDR, so that's eye movement desensitization reprocessing. And another kind of factor with people with substance abuse is like there's a trauma history. So the EMDR really works with that kind of trauma-informed care, building up safety resources.
We offer Injectable Naltrexone, which is better known as Vivitrol. And Vivitrol is a once-a-month injection that is used to treat people that have both opioid and alcohol use disorders. It covers all of the opioids, not just heroin, any kind of narcotic dependence you have. Vivitrol is an opiate antagonist. It sits on the mu receptor, so it prevents a person from being able to utilize any kind of opioid. If in fact people choose to use opioids while on Vivitrol, they will not feel any kind of level of intoxication, and the greatest risk is that they will overdose.
We have a certified gambling specialist on staff who is bilingual, both Spanish and English, and we are happy to treat people who feel they have a gambling problem.
The majority of referrals to treatment, and not just to Gavin Foundation, but treatment in general, is Caucasian. And so we have to get out into those other communities and educate people on the need for treatment and how to access treatment.
We have here in Boston for first time the AWOL in Spanish. We have that in English, but we never had that in Spanish. And came to the idea that we can do it with the Latino community.
Oftentimes when people are sober 2, 3, 4 months, you begin to see issues maybe of depression, not necessarily, but you might, depression, bipolar illness. And having someone like myself on board makes it a win-win situation for patients. They may be doing okay in their recovery, but their mind is racing, or they're depressed and they just can't get out of it. Is it post-acute withdrawal, or is it something more?
Accra is an adolescent community reinforcement approach. It is ages 14 to 22 throughout Norfolk County, and we do community reinforcement. So after substance abuse treatment, you will come to us and we can do continuing care, further the care. Peer mentoring, pro-social activities, recreational activities, just community reinforcement. It's a family wraparound program. Getting every client to see that they are worth sobriety, that they have self-respect, that they can pull out of them somehow. There is a bright light at the end of the tunnel that is worth living. You know, life is worth living. Sobriety is amazing.